on prevention, management, and stroke care. Today we have with us Dr. Shirish M. Hastak, MD Medicine, DM Neurology, Consultant Neurologist and Regional Director, Neurology, Stroke and Neurocritical Care at Gleneagles Hospital, Mumbai. Welcome, sir. Thank you for joining us today.
Thank you, Anushka.
So, as we start this session, my first question to you is what is stroke? And elaborate and explain our audiences about what stroke is.
Yes, stroke is basically a blood vessel block or a rupture of the blood vessel in the brain. So, based on this, there will be two types of strokes. So, if the blood vessel is blocked in the brain, it's called an ischemic stroke. If the blood vessel is ruptured in the brain, it's called an hemorrhagic stroke. And if the blood vessel is ruptured inside the parenchyma, that means inside the solid components of the brain, it's called intracerebral hemorrhage. Whereas if it is ruptured in the coverings of the brain, which is called the subarachnoid space. So if it's ruptured in the subarachnoid space, it's called a subarachnoid hemorrhage. But essentially, for people to remember, it's simple to say ischemic stroke, which is 80%, and 20% are hemorrhagic strokes. So these are the two types of strokes that take place, and it's important for you to remember that these are two types of strokes that you have to worry about.
Thank you so much, sir, for explaining what stroke is in details. So, as we go further, what are some of the early signs that people should look out for when it comes to stroke?
Okay, so the stroke early signs are very important because, unlike a heart attack, which is, and of course, stroke is called a brain attack to make a similarity between them. But the difference is that heart attack will usually present with pain, and pain in the chest, whereas stroke presents with different manifestations, and that's why it is a little bit more complex problem. So for you to be able to note that this is a stroke, there is an acronym called BFAST, and so BEFAST, that is the acronym, and each word stands for one symptom. So B stands for balance problems. So if you see someone who's not able to balance himself properly, this could be a stroke. E stands for eye problems. So if you see someone who suddenly complains that he cannot see well with one eye or cannot see on one side with an eye, then that could be a stroke. Similarly, if you look at face, so if someone suddenly deviates his face to one side, and so that could be a face problem, like I'm doing just now, and I'm doing it for you, but that could be a stroke. And then arm. So if you ask someone to elevate his arm like that, and if his arm goes down like this could be a stroke. And if this has happened suddenly, it could certainly be a stroke. And of course, the A includes the leg as well. So the arm includes the leg as well. So if the leg suddenly becomes weak, then that could be again a stroke problem. So, and then after that is speech. So S stands for speech. So if a person cannot speak properly, so like I'm speaking to you just now, but suddenly I go, pop, 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 like that, then that could be a stroke. And so speech problem is also an important symptom of stroke. And the other thing you must remember is that you need to rush your patient in time. So be fast basically stands for balance, eyes, face, arm, speech, and T stands for time. And time is rush in time. And so this is a very important concept that you must rush your patient in time.
Thank you so much, sir, and for emphasizing the acronym Be Fast. So, as we move forward, I'd like to discuss about the risk factors that that make a person likely to suffer from stroke. Is there a certain age group or a gender predilection when we look at the higher risk factors for stroke?
Yes, as you are well aware that 1 in 4 person in their lifetime will get a stroke. So it's a very common problem. In fact, it's the number one cause of adult disability, number two cause of death in the world, but the number one neglected problem is neglected both from the sides of symptoms, and I explained that to you with Be Fast, and it's also neglected from the side of the risk factors. So if you look at the risk factors for stroke, you will have blood pressure, diabetes, and so on. But of course, your question was about the age. So age is is an important risk factor. Like above 60 years of age or 65 years of age, stroke becomes more common. But I also want to emphasize that stroke happens from womb to tooth. So it can happen in the womb of a mother also, a stroke. And at the same
Okay.
time, it can happen at late age as well. So stroke is not just an old age disorder. Yes, it is more common after you cross 65 or 70, but it can happen at any age. And it can happen in a child as well. It can happen in an unborn child as well. So stroke is a very common disorder. It can happen at any age, and you must consider stroke in the differential of your thinking or in your thoughts when anyone gets the be fast symptoms. So it's very important for you to realize that this is not just a later age group problem. It can happen at any age. It involves both the sexes. It's pretty common in both the sexes. Of course, there are some types of strokes which are called venous strokes, which happen more frequently in the female as compared to the males, but these are rare strokes. But the common strokes can happen to either of the sexes, are more common in the later age group, but can certainly happen in the younger age group as well.
Thank you, sir, for your insights. Delving deeper into what you just shared, so how does the family history, genetics, and lifestyle play a role in increasing the chances of stroke?
Right. See, mostly the family history and the genetics is not a big factor in
Okay.
stroke. And but what is a bigger factor is are the risk factors, and these are mostly acquired risk factors. Uh, yes, to some extent, genetics may play a role in terms of getting diabetes. So diabetes is one of the risk factors, but the it's not a big contribution of genetics to stroke. The other thing that's very important in terms of the risk factors is hypertension. So you must remember that, what I recommend to you is please check your blood pressure today. And if you're over 50 and you haven't checked your blood pressure in the last 1 year, do it today. Because blood pressure is a silent killer. It doesn't give you any symptoms. Since it doesn't give you any symptoms, it can lead to a stroke without giving any symptoms. And so lots of times patients come to me in the hospital and say, Doc, my father got a stroke. I don't think it's blood pressure, but I'll ask them, have you checked his blood pressure? They say, no, we have not checked his blood pressure in the last 1 year. And frequently the blood pressure is high. Similarly, the other factors which are important is diabetes, and also the other factor is cholesterol or the lipids in your blood. And then the other risk factors that contribute to stroke is lack of exercise, improper diet, excess salt in your diet. So if you're eating high salt, then you're prone to get high blood pressure, and from the high blood pressure you can get a stroke. Similarly, alcohol and smoking are risk factors for stroke, and also need to be taken into account. So I think in stroke, it's not the genetics which is key, it's the risk factors which are key. And then, of course, there are direct causative factors also for stroke, which are a little different than the risk factors, and so they also you need to find out, but they are a little different in that they are direct causation factors. And direct causation factors can be, heart rhythm irregularity, which is called atrial fibrillation, or clots in the heart, or a heart attack. These can be direct causative factors, or arterial blocks in the neck, or dissection of arteries in the neck. So risk factors have a little less contribution as compared to the direct causative factors. The direct causative factors are directly responsible for the stroke, but the risk factors over time are definitely contribute to stroke in a very big way, because these are very common, the risk factors. So I think we must emphasize on risk factors in stroke, and you must check your risk factors today. Especially if you're over 50, I would recommend that you check your risk factors.
Thank you so much, sir, for elaborating about the risk factors and the causative factors, and also focusing on several preventive strategies like regular screening your blood pressures if you're above the age of 50. Moving forward, sir, when we look at patients who have probably suffered from stroke or are hypertensive, there's a pattern where patients tend to not take their medications regularly. So, what would be your advice to such individuals?
Yes, this is a very important thing to note that, as I said, that hypertension is a silent killer. So,
Yes,
most of my patients will come back and say, Doc, I had no symptoms. So I stopped my blood pressure medicine. So remember, blood pressure doesn't give you any symptoms until it creates a serious problem like stroke or heart attack, you know.
definitely.
So you have to remember that these silent killers, you need to check your blood pressure. There's no other way to know your blood pressure. So don't go by the symptoms. Normally our thinking is if you're asymptomatic, you're safe. In hypertension or blood pressure, you're not safe if you're asymptomatic. You are safe only after you've checked your blood pressure. So very important for you to check your blood pressure. And if your blood pressure is high, normally we say 140/90, but now the thinking is 130/80. So if your blood pressures are over 130/80 on repeated testing, important for you to take your medicine, and very important to take it regularly. I must say that I myself take my blood pressure medicines very regularly. So, lots of times my patients get convinced when I tell them I've taken them for the last 10 years. So, it's very important for you to not stop your blood pressure medicine and continue your medicine continuously.
Thank you so much, sir, for that recommendation and that advice. So, as we go forward, I wanted to understand your insights regarding the role of community education in reducing the risk of stroke at large scale, and how can we, improve it in India when it comes to
Yes,
community education.
yes. So, community awareness is a very important part of stroke since it's a more complex disorder than heart attack. Because time and again, I see patients coming in, and there is a golden hour in stroke. Like there's a golden hour in heart attack, there's a golden hour in stroke. The golden hour in stroke is frequently missed because we have not made our community aware about be fast. We have not explained to them what is be fast. So that is one thing. And usually patients will come outside the 4.5 hour window. And so there are two windows in stroke in and which we must make the community aware. The 4.5 hour window is the window for IV thrombolysis. And so you must be aware that this is the first window of stroke, and there is another window of stroke which is in the first 24 hours. The first 24 hours is the mechanical thrombectomy window. So these two windows exist. But the earlier you come within the window, the better your chances. So it should not be that when I say 4.5 hours, you should wait for 4 hours and then come to the hospital. It should be you should rush to the hospital as soon as you have any symptoms of be fast. And that's what be fast stands for. Be fast, come to the hospital fast. And of course, you must understand that in stroke, the brain damage doesn't occur as soon as the stroke starts. So if just by chance I get a stroke right now, my brain is not damaged completely at this second. But over the next 3, 4, 5, 6, 8, 10 hours, gradually my brain gets damaged, and it becomes more and more irreversible over time. So it's very important for you to understand that the later you get your patient to the hospital, the less likely he's going to reverse in terms of stroke. So it's very important for you to rush to a proper hospital for stroke. And so the other community awareness which I want to do to you is rush to a proper hospital. And this proper is a very important term. By proper, I mean the hospital which has a code stroke activation, which has a stroke team available, and which has imaging available 24/7, 365. So it should not be that, today is a Christmas day, so, we don't have any doctor available. and we can't treat the stroke patient. So don't go to a nursing home for stroke care. And right now, I would recommend my listeners to think of a hospital, proper hospital, which is within 30 minutes of them. I would not recommend for them to go 1 hour or 1.5 hours away. It's within 30 minutes of them. And of course, Gleneagles Hospital, Parel has such a facility. But you should look at a hospital which is close to you and treats stroke properly. This is also called a stroke ready hospital by the World Stroke Organization. So I think this is an important concept that you need to understand, that go to a proper hospital where proper care of stroke will be taken. You go to a wrong hospital, you will not be treated properly for a stroke. So this is the second community awareness that I want to do. Having said this, I think prevention, of course, we touched upon it. Prevention is a very important part of stroke, and also, we need to create awareness amongst the community about the prevention of blood pressure, sugar control, cholesterol control, exercise regularly, diet control, reducing sodium in your diet, stopping alcohol intake and stopping tobacco as far as possible.
Definitely, sir. So, as we move towards concluding this session, I have a few more questions for you. So, what is TIA, if you could just elaborate on that?
Yes, a TIA stands for transient ischemic attack. And transient ischemic attack means right now, if I suddenly cannot speak and my hand goes weak suddenly, my right hand is weak, I cannot speak, but I recover. In 5 minutes, I'm back to normal. That means what I had is a transient ischemic attack. And a transient attack means there are some clots which are circulating in your system, which have gone into the brain, and they have created a stroke, but that clot is broken up. Because it's broken up, I have recovered. So this transient ischemic attack is a very important attack, because the reason is you can prevent a stroke. So you have to rush to the hospital if you have a transient ischemic attack. So if you have any of the be fast symptoms, as I said, anytime, but you have recovered, please don't neglect it. Don't say I've recovered and I don't need to go to the hospital. Please rush to the hospital, because a transient ischemic attack, the next stroke may happen very rapidly and can be a huge stroke. So it's very important for you to rush to a proper hospital, get yourself checked with an MRI, an ECG, or 2D echo to find out, A, have you had a stroke? And if you have had a stroke, what is the cause of the stroke, and get proper treatment, preferably from a neurologist. That's what I would say about a transient ischemic attack.
Thank you so much, sir. So, moving forward, if you could throw some light upon walk with the doc idea, what is it about?
Okay, so Walk with a Doc idea is an idea, it's an international organization, but in India, we started this Walk with a Doc for the first time in 2017. And till date, we have had about 70 different doctors talk to the community about health issues. So, like stroke is of course an important health issue. So we've had number of doctors talk about stroke, but we've also made people aware about other problems like heart attacks, control of diabetes, control of your blood pressure, and multiple specialities have specialists we have had. So till date, we've had about 70 Walk with a Doc programs. So 70 different doctors have come into the community, and we have this program at the Mahalakshmi Racecourse every first Sunday of the month, 7 o'clock. Everyone is welcome. It's a community program. A doctor comes in, speaks for 20 minutes. There's a 10 minutes question answer, and then we have a 30 minutes walk with the doc. So he walks with patients, with relatives, with families, and he can answer your questions in a very free environment. And this doesn't happen in the hospital or in the clinics. So we wanted to sort of be a, bridge the gap idea between doctors and patients. And that's what is Walk with the Doc. And, I must tell you that there are more than 300 Walk with the Docs in the United States, and there are only two in India. So we hope that, we start more Walk with the Docs in India. And I am very keen to move this idea forward.
Thank you so much, sir, for sharing the details of Walk with the Doc with us. It was definitely interesting to understand the concept And I hope we can expand the same in India and achieve more community awareness. So, as we conclude today's session, I would request your concluding
Can I make
remarks.
one more comment, Anushka?
Sure, sir. Sure, sir.
Yes, so we have also realized that, as I emphasized on you, the be fast and the awareness about stroke coming to the hospital time. We've also realized that a large number of hospitals, in the private sector, but more so in the public sector, have difficulty in doing thrombolysis and treating strokes. So we have taken this up in Maharashtra through the Mumbai Stroke Society. We are trying to build up a telestroke program for Maharashtra as well. We hope that we can push this idea and help more people get treated with stroke by a telestroke care model in Maharashtra as well. This has been taken up well in a couple of other states in India like Haryana and Punjab. So we feel that Maharashtra should not lag behind, and we must move telestroke as well in Maharashtra. And this is my dream for Maharashtra. So I look forward to helping more people with stroke, helping them with treatment, helping them with prevention, and of course creating awareness in the society and in the community. Thank you, Anushka.
Thank you so much, sir, for your insights today. I think expanding programs and learning from the other states and implementing them in our own states is it's a great initiative. Thank you so much, sir. So, is there any recommendation from your end to the policymakers regarding stroke awareness that can be done?
Yes, I think one of the things that we need to probably do is to connect to the rural hospitals, and so I'm very keen that the policymakers of Maharashtra, since I stay in the state of Maharashtra, take this up at the level of the rural hospitals and at the level of the because there are lots of CT scan centers in this state, and so those rural hospitals which have a CT scan center, it's very important that we make them aware about stroke, make them aware about the window of opportunity of 4.5 hours, and of course 24 hours, but more importantly the 4.5 hours, and also help them with the thrombolytic agent and help them with the telestroke model. But I think the number one priority is sort of getting them onto the awareness about stroke and onto the teaching model for stroke. And we, the Mumbai Stroke Society, can certainly help the policymakers do this for the state of Maharashtra.
Thank you so much, sir. Thank you so much for that, and thank you for your valuable time today and sharing, insights regarding stroke awareness. Thank you so much.
Thank you, Anushka.